You as a teenager are under your parents' insurance, but what if your parents all of a sudden had no insurance to pay for your sports injuries or your cheerleading injuries? Universal healthcare can contribute to a longer and better life, as well as reduction in social inequality. Economists always will say that universal healthcare is a radical and social idea, but this could not be farther from the truth. Many other wealthy nations have greater lifespans and are able to pay for a single payer system. So why can't we? Why should you care? Well, like I said before, according to Procon.org, the lack of health insurance is associated with as many as 44,000 deaths per year, which translates into a 40% increased risk of death among the uninsured. And you could possibly be among these numbers. And as someone who comes from a family that faces hardships with affordable health care, I can understand where the argument for universal health care actually comes from. Noteworthy advantages to quality care includes lowering the Medicare costs and obtaining a healthier population. But the main factor that most people actually care about is whether or not we can actually afford universal health care. Affordability or Medicare costs is one of the only things that people actually care about when they bring up the topic of universal health care. One way we can do it is by increasing the total income and government taxes. By increasing taxes, we don't need to pay for the healthcare system we have now. Now, some people may say the opposite. That universal healthcare oppose universal healthcare because of increased taxes. But here's the catch: when in increased government taxes, you won't have to pay any premiums, co-payments, or deductibles, all of which would cost you more money than just paying increased taxes. Another way we could pay for universal healthcare is from our military budget. According to Data for Progress, we spend $725 billion every year for military defense. Much of this spending is money that our military isn't asking for. Reducing military spending will help decrease the amount that citizens have to pay in taxes. Reducing military spending and increasing taxes not only provides for universal healthcare, but enables a healthier population. A healthier population is also one of the many advantages of converting to a single-payer healthcare system. Universal healthcare equalizes services with no doctors or hospitals being able to target and cater to well-through clients. This means everyone gets the same level of care, which ultimately leads to a healthier workforce and longer life expectancy. Another way that healthcare leads to a healthier population is that it provides a higher quality of healthcare. Quality could suffer under the universal healthcare system, but if there was more waiting lists or a severe underfunding of the system, this is the case for our current system. Any rational design of the UHC system would ensure appropriate funding of the system and would also strive to strike the right balance between overutilization and underutilization of health care services so that waiting lists would be minimized. Implementing universal health care would be a very big step in improving one of America's biggest problems of helping the uninsured. Affordable health care and a healthier population is a vital problem in America right now, and I believe a single-payer system could help with that. So before you listen to any economist that says we can't afford a universal health care, just remember that economics might be the only profession where a person could be called an expert without having once been right.